So not everyone knows that chemical peels are great options for arms, hands, and legs as well. They give the age away. And I would say that when you examine ginger a little bit closely, you can see a combination of skin with some patches that are dark. You'll see pink patches as well, and white blotches, and a lot of fine wrinkles. And some areas are a little bit rough and crusty, like the patch right here. I can even feel it with the eyes closed, even on the tops of the fingers. So a chemical peel here would be great. What I'm going to do is that I'm going to use an accelerator to exfoliate the dead layers of the skin, and I'm going to apply almost 6 layers of Ultra Peel Forte, and then I'm going to boost the peel with a retinol at 6%, and we will demonstrate. So Ginger, tell me when you start burning a little bit. I think typically the hands, because of thicker skin, doesn't burn as much as the face, but I would love to know if you don't mind.
Okay, not burning yet. It'll take a while to get through this alligator skin.
I think you'd be surprised. This chemical peel can definitely be very effective, especially with the accelerator right there. That means we can definitely get better penetration. But you know what I would be excited about? I would be excited about having the baseline pictures, and then in a couple of weeks looking back at the pictures and see what we've achieved. Yeah, see if we've kind of like managed to sort of like blend in the tone of the skin. And then, like I said, it's always a series of chemical peels. It's definitely an illusion to think that one chemical peel will be sufficient. It's bit by bit.
That would be nice. It was just one.
I know, right? Now, there's at least one grade of a chemical peel that I use that is definitely more aggressive, and it's just that sometimes the healing can be a little bit hard, and I would be very open-minded to getting one done if you don't respond to this particular chemical peel. But I always like to leave room for improvement. You understand what I'm trying to say?
Mm-hmm.
One depth more, one layer more, one more aggressive chemical peel.
Well, just like on the face, we knew that the regular chemical peel just didn't
Exactly.
cut it.
Do you remember a couple of years ago?
Yes.
Yeah.
I had it done, what, a year ago,
Yeah.
January, and then this January, and it's still...
And I think, you know, what you had was a great chemical peel as well, but what I want to say is that now we have more variations, we have more options to customize, we have more focused chemical peels, and we can combine with this system, the PCA system, several chemical peels together to achieve different goals really. And I think that what you had a year ago, let's say, was a very reasonable chemical peel, but different people respond differently. I mean, it was just not the right peel for you. And I think, do you remember when you came back and you said, but I didn't have good results, and I said, but you have to try a new system, and how the second time around you're like, wait a minute, yeah.
Well, was it the same one we did
No.
this past?
Yeah, this one,
this January?
This
Yeah.
past one is a similar type, yeah. But gradations, they come in at least 6 gradations, at least 6 of them. How's it going, Ginger?
Good. I don't feel anything yet.
So we are on layer number 4. Now, typically, if we were to do this on the face, you would definitely start stinging a little bit. And what I want to say, Ginger, is that typically, pre-treated areas definitely will burn a little bit more when we're applying chemical peels on skin that has had a little bit of retinol or other products. The skin may burn a little bit because it's already exfoliated. Now, you know that this is winter and you've pretty much been careful with the sun, so that's why I'm very motivated to get this done. And I wanted to say this is still a perfect time, because right now we can escape with another one in March, the third one in April. I even sometimes do chemical peels in the, closer to May, early May and mid-May. But June, July, August would be a little bit tough.
Well, it would, since we own a boat and it's hard to stay out of the sun.
I know,
when you're on
I
a
know.
boat. Well, there's enough place to stay out of the sun, but
But still. Well, I guess for you, this is also perfect timing because, you know, you've been out of the sun for quite a bit of time.
Yes.
But I mean, I would have to say that globally, chemical peels are all about the preparation. I mean, if you don't prime the skin very well, or you don't prep it very well, especially in patients that I don't know very well, sometimes the outcome can be challenging. So I always like to see new patients at least and visit with them and understand their skin routine very well, understand their goals very well, and then depending on their goals and their skin type and their needs, start a pre-chemical peel routine. I mean, with you, we've done a lot of things in the past out of caution.
Mm-hmm.
Are you feeling? Pretty much, I think what's going to happen on the nose is pretty much the same, but a little bit more burning. What's going to be interesting for the nose is to show patients how the precancers will become a little bit whitish and will highlight in a white color. And that helps sort of like confirm the diagnosis of a precancer. It's almost like a little indirect diagnostic test. And what we'll do is that we'll share with our patients probably towards the end of the chemical peel how the precancers on the nose look like. Now the final layer will be that what I call the icing on the cake, which is the retinol. We didn't show the stage where we applied the accelerator on the skin, but that was pretty simple. So what I would be looking for is a certain pinkness in the skin and a certain white gloss that tells me exactly which level of the skin I'm in, and that definitely takes a lot of expertise. Under peeling or over peeling is never a good thing. How are you feeling? Good. So we'll pretty much do the same on the other arm, and we'll demonstrate the nose in a second.